Welcome to Fertility Associates Hamilton. This is our waiting area, so if you come to reception and you're here for a consultation, you'll be seated here and greeted by one of the doctors or the nurses. If you're here for a procedure, you will be sent to wait in the other separate waiting area, and that's the area where we do the procedures and the scans. We have 2 doctors' consultation rooms where the initial consultation will take place, and also any follow-up appointment to review the progress of the treatment and patient's response to drugs. After your consultation with the doctor, a nurse will meet with you in her consultation room, and she will provide more information about what was discussed with the doctor. It's also a very good time for you to ask any questions you may have. We will phone patients every day with blood results by 5 o'clock. However, for some areas, blood results get here late from the various local labs from the different areas. So it may be that some days we won't have results until after 5 o'clock. However, if we didn't phone you, please do give us a call just to remind us that you're waiting, and then we have a good opportunity to provide some explanation if the blood result was late or that we're still processing the blood results and consulting about it between all the disciplines.
Go to blood result for one of our coaster patient who has been coasting for the past 5 days. She's down to 10,000 today, so can we trigger her?
Now that she's down to 10,000 today, that would be fine.
They did blood today, so no more bloods, no.
The weekends work exactly the same. The only difference is that in some areas during the weekend they don't have local labs to collect the bloods, and this means that you may need to travel somewhere else to a different lab. The nurses will instruct you exactly where's the nearest collection point for you. There's something special about the Hamilton Clinic. It was designed to give a sense of privacy. So when you first come here, you can go right to the reception, report there, and then if you're coming to see a doctor for a consultation, you will be seated on one area. If you're coming here for a scan or procedure, you'll be seated in a separate area. This is an ultrasound room where during your first consultation the doctor may wish to do a baseline scan. We also have another scan room on the procedural side where we would monitor the size of the follicles and monitor their development and growth to know when the likely ovulation time is or when we want to trigger you to start the IVF. For out-of-towners, if they're not staying with family or friends, we're right in the middle of Hamilton, so there are a lot of options of accommodation to choose from. We cover 4 districts. We cover the Waikato, Bay of Plenty, Lakes District, and Taranaki. We have periodic consultation clinics running in Tauranga and Rotorua, so if you live there, please ask us about when is the next available time. We have Dr. Ravikanti, who sees the patients in Tauranga. She will also do review appointments. If it's difficult for you to travel here for the consultation, we'll try and facilitate those in Tauranga. And in Rotorua, we have Dr. VP Singh and Dr. Lakshmi Ravikanti. We ask patients to complete all the lists of initial bloods at their local labs. They don't need to come for that. We get the results, we assess it, and then we're fully prepared for the consultation. This is what enables us to have the consultation here or in Tauranga or in Rotorua. As far as procedures, we do ask the patients to come here for procedures and follow up for the treatment. This is one of 3 recovery rooms. This is where the medical staff will monitor your recovery after procedures. It's equipped with an emergency call button, so if you're feeling unwell or you would like assistance, you can always push the button and a nurse will be with you very quickly. This is our theater. This is where procedures take place and miracles do happen. Patients here coming for IVF will have their egg collection here and the embryo replacement here. This is the hatch to the embryology lab. This is where the eggs and the sperm will be transferred to the embryologist on the other side, and where embryos will be transferred from the embryologist side to the doctor to replace. We also have a monitor inside for the embryologist to show the patient exactly what they see under the microscope and which embryo they're going to replace. This is our embryology lab. It's especially designed to provide optimal environment for embryo development. The air is provided here in positive pressure, is set to filter fine particles, and is also set at a specific temperature. Access is restricted to embryologists only. This is where the embryologists monitor the development of the embryos and create future babies. This is where we join the sperm with the egg through different techniques. We culture the embryos inside those incubators. This is the hatch connecting the embryology lab with the theater.